70% of American adults now have at least one shot of the COVID vaccine. But the number of COVID cases is now higher than last summer's peak.
COVID-19 vaccinations are on the rise, but more people are getting infected as well. UW Health Chief Quality Officer Dr. Jeff Potoff joins us. Last week, you were sitting here on the set without a mask. We're back to the Zoom. It shows you how much things can change in a week.
Yeah, I know. You know, science isn't known for its twists and turns, but we sure have them.
Well, we had troubling numbers today. 1,391 new cases in the last day. That is the highest since February 10th.
In Wisconsin.
In Wisconsin, which is almost 6 months ago now. So what's going on? Is that the Delta variant?
It's the Delta variant, and you know, when we took away masks and distancing for those who are vaccinated, we know that a lot of unvaccinated folks did the same thing. They got rid of their masks, they started to gather. So you combine a highly transmissible variant with folks that are giving it the perfect opportunity to infect them, and you start to see these case numbers that we're starting to see now in the state.
Us here at the station, a lot of businesses now are requiring masks indoors, even for vaccinated people. What's changed there?
So back in May, the best science said that before the Delta came around, if you were vaccinated, got exposed to COVID-19, not only was breakthrough very, very rare, but the ability to transmit to other people wasn't really there. You couldn't do it. Now with Delta, that's all different. Breakthrough cases are not common, but we see them more often. And those people who are vaccinated who do have a breakthrough case carry enough virus in their nose to actually transmit it to other people. So almost the opposite result of what we saw in May, and hence the recommendation to mask.
So breakthrough infections of the Delta variant are contagious. Even if you're fully vaccinated, you have the potential to spread it to someone else as the same way as an unvaccinated person would. Is that right?
That's right, and that's the difference from May. In May, with previous variants, not Delta, you couldn't spread it to other people, so you didn't need to wear the mask because you were no risk to anyone. Now with Delta, that's changed, and that's why you're seeing these recommendations, even for vaccinated, to wear a mask, especially in areas with high transmission and in crowded areas where there are likely unvaccinated people around you.
Well, the good news, though, Dr. Potoff, is hospitalizations from the Delta variant are very low. Is that true?
And those who are vaccinated, they don't get very severe disease. In fact, many of them have no idea that they actually have the virus at all. For those who are unvaccinated, we are seeing hospitalizations of folks with Delta variant, and it's not acting a whole lot different than what we know with coronavirus as far as, getting people sick, getting them really sick, being in the ICU. If you're unvaccinated, those risks all still apply to you.
I think a lot of vaccinated people are pretty disheartened by all of this. That, okay, we're wearing a mask again. What was this all for?
And I think that's reasonable. It's really disappointing, where we're at. I think the good news is that we'll get through this Delta hump. Ideally, if this does result in more vaccinations, maybe there doesn't need to be another hump. But if there is, we'll just undulate on this curve for a little while. But ultimately, I do think we'll get out of this. It's just, instead of having an end date and being done, we might have this tale of up and downs that go on for a few more months.
And I think the timing, it's August, and school is going to be here before we know it. That sort of increases a little bit of the anxiety about what the fall will bring. What do you expect to see?
I think we will, for the short term, continue to see some additional Delta cases. As more folks get vaccinated, as these mitigation strategies get put in place and we start to mask, we should be able to quickly decrease those numbers. But for kids going back to school, I think the most important message is, what we knew in May is not what we know today. And decisions that we made about how to keep kids safe in school back in May no longer hold true for kids that go back to school in August and September. So really important for those educators to really reevaluate their protocols and make sure that they're in line with the current science.
Yeah, it's a changing scene every day, it seems. Doctor, thanks for being with us today. Hopefully you'll be back here on the set sometime soon.
Dr.
Can't
Potoff,
wait to get back there.
thank you for your time. We appreciate it.
Take care. We'll be right back.